Welcome to our highlight interview session. My name is Okafor and I'm the co-chair of the 10th edition of the Oxford Africa Conference this year. I have the pleasure of introducing Mrs. Toyin Saraki. Welcome.
Thank you, Chi. I want to actually start by really thanking you for calling upon me for this opportunity. It's a pleasure to be having these conversations with you today.
Happy International Day of the Midwives. I know that this is a very important day for yourself.
Thank you very much, and happy International Day of the Midwife to you, and also happy World Hygiene Day. Yes. It's for me, it's particularly wonderful that International Day of the Midwife and World Hygiene Day coincide on the same day, because these are the two things that we really need to deliver health.
And I know that there are two focus areas for yourself at the Wellbeing Foundation, with both the WASH program and many maternal focused programs. I'm going to read a brief introduction about yourself, and then we can quickly just sort of get into that. Toyin Saraki, founder president of the Wellbeing Foundation Africa. She is a Nigerian advocate for women's and children's health and empowerment with 2 decades of advocacy covering reproductive, maternal, newborn, child and adolescent health, ending gender-based discrimination and violence, and improving education, socioeconomic empowerment, and community livelihoods in sub-Saharan Africa. Mrs. Saraki is the inaugural Global Goodwill Ambassador for the International Confederation of Midwives, Special Advisor to the Independent Advisory Group of the World Health Organization's Regional Office for Africa. She was named by DEVIX as the Universal Health Coverage Global Champion and is the Save the Children Newborn Health Champion for Nigeria and the Global Champion for the White Ribbon Alliance for Safe Motherhood. And I made sure to have my emblem on today specifically for this call.
Thank you.
Very heavy bio, but I suppose that comes with the very many years that you've been focusing on this area, and I hope that we're able to sort of tap into that knowledge and experience as we continue this conversation. So as mentioned, this year's theme is rewriting the African story and asserting our future. And my co-chair and I chose this theme because we believed it was important to use the platform that the Oxford Africa Conference has as the largest convening on Africa in Europe. We were really particular about addressing the many issues that plague the African continent without focusing too much on them. And we thought we could do this best by driving solution-oriented discussions I hope that we will have this morning. And sort of highlighting the excellence across various industries, yours included. I suppose my first question then would be, what are your key impact areas and how have they contributed to rewriting the African story?
You know, Chi, when I established the Wellbeing Foundation in 2004, I acknowledged that the fundamental necessity would actually be gender equity, the ability to thrive, and the empowerment of all women and girls. I wanted to stop maternal deaths, but I knew that I wouldn't be able to do this without addressing the social determinants. And I was accepting Africa as it was, but I was very impatient to change the parts that I didn't like for the better. And we know that addressing these social determinants isn't always going to be at the forefront or even a prioritized conversation in the sub-Saharan nations in particular. But from a very young age, and in the face of the adversity that I experienced during my own labor some nearing 30 years ago, I felt a very deep sense of obligation and a pride in amplifying the lived realities of the women and the families around me, both near and far. And it's no secret to any of us that when we apply a culturally tinged lens, time, albeit ticking, continues to be our universal constraint. There's an in-depth and arguably inbred bias that often comes with the concept of culture and tradition, but equally so, the time to move forward and to move our cultures and traditions forward is now. Time slipping away, and the length of time that we as Africans have been hesitant to move beyond the narrative as we have instituted and instilled and taught to us for so long is on the approach. As an African, I always used to push back when people set dates for me. So in 2012, when the world was talking about the Millennium Development Goals, in 2015, I was saying, why not now? And today, in 2021, when everybody's talking about 2030, again, I'm saying, why not now? Why can't we take the steps that we need to take now? You know, the path to development and the path to impact, it starts with a step. It doesn't start with talking interminably. It actually starts with the step, the measurement, the data, and the action. So together over the years, we've assessed, we've gleaned from and respected history, while collaboratively mapping out a road to a progressive future, reflective of inclusion, optimal health, gender equity, and the promise of and access to ways in which the well-being of women, children, and the entire family can be maintained, which is fast emerging. It's not a coincidence that the Wellbeing Foundation's Africa's programs, which we implement and work consistently to deliver, also include household outreach, because we know that a lot of the bias and in turn a lot of the influence begins within the home. Authentic dissemination strategies of the kind which seek to meet people where they are the most comfortable work best in dismantling long-standing culturally infused thoughts, ways of rearing, and ways of living, by way of cultivating very multi-layered, timely, and evidence-based strategy approaches to research, advocacy, policy development, community engagement, philanthropy, and education. We continue to prioritize women, adolescent girls, and children within our various programs, with the primary priority of ensuring that reproductive, mental, economic, and social health in order to empower and strengthen girls and women from birth to old age occurs. I've always believed that life's journey begins at conception and it's actualized through birth. So when we promote equity and empower and educate frontline community health workers, particularly midwives, as they are at the front of, and nurses, increase accessibility of a sustainable maternal, newborn, infant, child, and adolescent continuum of care through a lifetime of healthy habits, from reproductive health education and family planning to improved water, sanitation, and hand washing, and nutrition behaviors. And we also advocate for gender equality with the acknowledgement that the status of women, children, and families in Africa requires improved resources, support, and advocacy.
Brilliant, and I think that's a great call to action. The time is now, and it's quite timely to be speaking with you. I'm in line with our theme this year, and also sort of probably prompting my next question in terms of evidence-based research. In our conversations, we usually sort of emphasize the importance of data and the advantage of locally established NGOs like the Wellbeing Foundation being able to sort of apply a bottom to top approach, in reaching these sources of issues that can very readily be compiled into real-time data. Can you probably maybe dive into this a bit more and share some sort of tangible data results and impact, and also help us understand why in your findings this is important to the advancement of the continent as a whole?
When you look at the WHO data, which says very clearly that the total health workforce in Africa currently stands at 1.64 million people, of which health service providers, doctors, nurses, midwives, laboratory technicians, and community health workers make up 1.3.6 million of the workforce, there's both power, proof, and further progress deriving from these numbers. Then you look again at the data and you realize that in 2010, Nigeria actually had very, very dire mortality. It's bad now, but it's a lot better. We've made, I think, a 35% improvement actually on our older figures. Now, that improvement was from, in my opinion, one very key program. The improvement was from the midwife service scheme. The Nigerian government actually brought back 4,400 retired midwives back into frontline service and sent them across the country. Now, what this meant was there were more midwives who could look after more women. So women were hitting that target over those 5 years, 2010 to 2015. More women had a midwife attending them at birth. And I was deeply involved in that program. At the same time, I was also rolling out personal health records, home based health records across Nigeria. And I must say, these weren't new. Home based health records were actually very first deployed in Nigeria in the 1950s in a village by Professor David Morley, who was an English researcher who was working in Nigeria, and he created the first scorecard. And this meant that the women could, in a simple diagram, understand their baby's growth and actually be an equal partner. So very early on, I recognized the importance of data and data as being accessible, livable, reachable, not just something that's on somebody's laptop or in somebody's graph, which nobody else could access. So many of all, if not all actually, the programs that we implement at the Wellbeing Foundation Africa are delivered by real people in real time who dedicate their days to understanding specialist areas of well-being, health, and social progression. They put the front in frontline, usually my midwives, my doctors, and my nurses, and they deliver care to the very last mile and in some of the most remote areas. While technology and simulation models play a huge part in the dissemination and demonstration of our insights and reiterations of optimal ways of living, without these people, without this healthcare workforce, the interlocutors, and the other people, the women and the children, the process of dissemination itself won't actualize in its potential. In essence, our data only becomes livable and learnable data when its methodology and the actualization thereof has been tried, tested, and proven and accepted through and with the people. So, what my Wellbeing Foundation Africa delivers on the ground contributes to a bigger local and global picture that is solution based and promisingly adaptive. I've never been one of those Africans that accepts a lesser quality, with the excuse of because it's Africa. Because I will tell you that a woman in labor, irrespective of where she is in the world, wants the same thing. She wants to survive that delivery and she wants her child to survive. So I've always felt very strongly that we have to carry our own knowledge and learning across to wherever it's needed. Because now, as we're looking at the research of Black and minority ethnicities, we know that our learning too is of equal importance. And I have never really taken a north-south approach. I have taken what I will call a level table, even if the playing field is tilted, so that we can actually marry all the knowledge we need to deliver the impact that we need rapidly, quickly, efficiently, and measurably. And for me, each successfully acquired round of funding leads to the mapping and delivery of a successful trajectory for women, children, and their families. And in doing so, we move the financial numbers to numbers that are reflective of betterment, advancement, and optimal health. And we get the data that we need to prove that what we're doing works. My global advocacy has also worked to amplify the importance of personal health records hugely, and immunization records, vaccine scheduling, as just one of the many examples of contributions to national data collection, the road to innovation, which has been extensively remapped under the pressure of the last year during this coronavirus pandemic, which has also proven to us that adapted solutions and the ways of working, recording, and capturing data must continue to emerge and evolve, and that the start of the data capturing journey begins with the one who enables life's journey to begin, the midwife, who is at the knee and the belly of the mother. She's often the first eyes to see, and quite often the first hand to touch the newborn life. So for me, the midwife will always remain my key interlocutor while I begin to put task-shifting teams of doctors, nurses, coaches, community health workers around her. The midwife remains at the heart of my organization. And the midwife at the heart of my organization is delivering results.
A power-packed response there. Definitely agree with your focus and intentional focus on the frontline worker and how that feeds into to overcoming these issues. And of course, the importance of data and the ability for organizations like the Wellbeing Foundation to be able to sort of churn that into sort of very real-time data that can, is applicable and can address the root causes that I think is something that's usually overlooked in the African continent. I really just wanted to speak to your EMONC program, the Emergency Obstetric and Neonatal Care, where you speak to preventable causes. The program addresses preventable causes, and you have trained these frontline workers in basic and comprehensive emergency obstetrics. Are you able to sort of share more about that?
Yes, I when I was looking at the deaths in Nigeria, I started to believe that in order to overcome the problem, we had to seek to understand the problem in greater detail. And when I say understand, I'm referring to a dual approach that truly identifies the group of people or persons that the problem is affecting at the most granular level, and also identifies how culturally, economically, and socially best each person can be supported towards a more optimal outcome. And then once we identify these two factors, we can begin to become an authorized and respected and recognized provider of solutions. And the Wellbeing Foundation's mission to improve health outcomes for women and their babies, it really took our global advocacy to the global stage, because we believed that to overcome maternal mortality, opportunities had to be available to all people, irrespective of gender, tribe, or class. And then I started to say midwives require whole system support as defenders of a woman's rights and health outcomes, to better identify and support those who are most at risk, and to have true efficiency and enjoyment in their daily roles. And I'm a champion for equity, but I'm also a realist. So at the front line, what I was finding that most women health professionals and carers instinctively understood women's healthcare needs best, and were therefore best placed to encourage and deliver the basic things like family planning, counseling on pregnancy related issues. They would coach the women until the point of delivery, and they would support the woman at the juncture of rearing and nurturing the newly welcomed neonate. Female community health workers were also instrumental in reaching the underserved and the most marginalized members of the community, especially in the areas with weaker health systems. But yet, the deaths were continuing. And when we looked at the deaths had 2 or 3 reasons: postpartum hemorrhage, obstructed delivery, maternal sepsis, or neonatal asphyxia. And these were all what in the North we would call major emergencies. But I also knew that there was training, usually pre-service, before you actually qualify to be able to tackle these emergencies. And I was looking at the births and deaths registers of Nigeria, and I said, okay, so what we now need, we know we now have more midwives for more women. We know we've encouraged women to come to the health facility to deliver. But what is happening? A woman has a breech delivery, she dies, the baby dies. Postpartum hemorrhage, why are we not being able to recognize normal load share from postpartum hemorrhage? And the key to that was emergency obstetric and newborn care skills and drills. And so I went around the world to find the experts and the tools which lay in simulation modeling. Now, to me, this was a friendly, innovative solution which sought to meet healthcare workers and the women that they care for at their level. So we prioritized investments that would power the positiveness of upskilling the frontline and promotes a continuum of care culture, so that the emergencies are detected long before they arise. So possibly I would say my Wellbeing Foundation Africa's greatest leap of confidence was in the promise of modern innovation in 2015, when we took up the EMONC programming as a whole state approach, and our midwives and doctors began to upskill in the area of EMONC specifically. It was a huge leapfrog in that particular, because their knowledge, their skills, and their confidence in preparing for complex obstetric emergencies immediately increased by an average of 18%, and the immediate drop in mortality was 22%. The partnership between the Wellbeing Foundation Africa and the Liverpool School of Tropical Medicine, supported by Johnson & Johnson Global Health, meant that frontline staff comprising nearly 62,800 health workers, 300 healthcare providers at 21 public medical facilities in the entire 16 local government areas across Kwara State have made it a priority, by learning EMONC and by practicing EMONC, to actualize the very skills they've acquired, leading to certain resilience and measurable exponential results. Now, it was a hugely expensive program, which was actually delivered at no cost whatsoever to the state government, but they continue to reap the results, because if Kwara State is just one state which are invested in that leap of faith in science and in a better community of practice to improve the availability and quality of maternal and newborn health, it has now maintained the highest survival rates in Nigeria for years. So I know that the priority, the focus, and the decision to implement such an educational program further to national scale is not only urgent, but will lie in the hands of legislators, governments, and policymakers, all of whom we need to present these ongoing successes to. We need to present them at the same table. We need to present them persuasively, with humility, but with the hard data and the evidence, and we need them to listen and to learn. It goes without saying that investing in the female health worker within the entire holistic task-shifting health workforce is a vital action for Nigeria to take to tackle the high maternal and child mortality. I've taken a similar approach to breastfeeding, and again, in the Lagos state alone, we raised breastfeeding rates from 38% to 51%. In Kaduna State, we raised breastfeeding rates from 22% to over 48%. And we even had a mother of triplets who exclusively breastfed her triplets for 6 months, early and exclusive breastfeeding for 6 months, a mother of triplets. So I know that the global approach that I've taken, that harnesses the best of the local and the best of the global and marries them together to deliver true change, is the way to go for Nigeria.
Brilliant. Thank you so much for really unpacking that. I think that's the importance of this conversation, is sort of getting into the strategies that Wellbeing Foundation has looked at overcoming these issues, but the best way that they can be scaled up nationally. I mean, imagine if you're having, I think you mentioned 22 to 51% increase in breastfeeding rates in a single state. Imagine sort of the knock-on effect if we were sort of scaling that up, and then again implementing in Africa. So thank you very much for taking us through that. You also mentioned actually that there was a 35% decrease in the over the years in the maternal mortality rate in Nigeria, but we're still not sort of there. We're overcoming that. And as the leading agency on maternal and newborn health in Nigeria, through your Mama Care 360 antenatal program, which I think is absolutely fascinating, how important is it for us to overcome Nigeria's current status as the largest contributor to maternal deaths in sub-Saharan Africa? And what are some of the additional strategies, maybe lessons learned, some take-homes that other continents can implement to overcome these same issues?
Well, let me give it to you a different way. So we know we're the second largest contributor in the world, and we're the highest contributor in Africa. Now, if you just look at our population, estimated at just over 200 million, you begin to understand that these investments, if taken to scale, if Nigeria makes it, the world will make it. I don't know if you recall that we were doing quite well on polio, and then all of a sudden there was this outbreak of the vaccine circulating polio. And as soon as Nigeria tackled that, the world became free of polio, because Nigeria was free of polio. But that actually is a typical example that I would like to use. I was First Lady of the state where polio broke out in 2019. Now, from 2003 till early 2019, we didn't have a single polio case in that state, even though we were surrounded by polio endemic states. Now, we didn't have a single polio case because we did practice very strong immunization campaign, ward to ward, local government to local government, hospital to hospital, the same day every week in every hospital. And then all of a sudden, people relaxed at some point, I think in June 2019, and polio broke out. So this has taught me that for us to sustain the gains, we have to constantly replenish and reinforce. And this is actually what led me to start the MamaCare 360 program. Very often, I will have experienced something myself, which I can take for granted, and then I will realize that my fellow Nigerian women can't take it for granted. So, for instance, antenatal care. We all know what antenatal care means. It means you go to either your community midwife or you go to a health facility. She takes your measurements. And in many countries, she also takes that opportunity to teach you about your body. When you then look at the ratios of midwives to mothers in Nigeria, I think the WHO ratio we're all aiming to reach is between one midwife to 200 or 1 to 400 as a total population. In Nigeria, our figure is 1 to 20,000. So the midwife that is in the health facility is so overworked, and that's if she's lucky enough to even be in a health facility that the women want to come to, because a lot of women will not access a health facility because they're scared of the cost or whatever. And one day I just woke up and I actually employed 3 midwives. I originally employed them behind the back of my foundation because sometimes when I want to test something, I take another leap of courage and faith quietly, and I employed 3 midwives, Eunice, Rita, and Mrs. K. And I said, look, I'm not a midwife, but I think I understand midwifery and what you can do. Would you be willing to give women free antenatal and postnatal lessons? And they said, what, at home? And I said, no, not at home. I'm still trying to encourage women to go into the health facility, even though I know a professional midwife can deliver a normal birth at home. Please just go to, map out the health facilities and literally start going to the waiting rooms and start giving them lessons. I will pay for the lessons. You go and give them lessons. Now, within 3 weeks, we noticed something. And, what I was looking at, again, I had to get my M&Es to begin to look at the data. But I was excited because the first week they were going to the health facilities, they were seeing maybe 15 women in the waiting room. By the 3rd week, in each of the health facilities, when news had spread, it became 90 women. I actually think that's the reason why the health facilities didn't drive them away, because they were increasing the customer base, but they were enjoying doing what midwives do, helping the hospital midwives, teaching women about their bodies, and making these women empowered partners. And then I met very interesting gentleman called Toyin Saraki, who is the world leader in simulation modeling. And he was kind enough to start a working partnership with the Wellbeing Foundation. And he gave me pelvic models, models of placentas. And, the idea was to teach the midwives in the facilities how better to have the practice on safe deliveries. But since my midwives were going to those facilities, they also began to teach the mothers what their pelvis looks like and what their placenta looks like when it was, completely and properly evacuated. And what can I say? We went from 3 midwives and 3 classes to 45 midwives and 8,000 women a month. And it's going strong. The real data behind it is that by giving these free antenatal and postnatal classes, our women are actually coming for 1 session a month. So every mama care mum gets one session a month. She's got a textbook where she can also make notes. The midwives have a manual, the lessons that they're teaching, and the hospital midwives are still getting on with the medical part of the antenatal care. But 278,000, I think, women later, in 5 years, we haven't lost a single mama care mum, and we haven't lost a mama care baby either. Now, when you consider that 1 in 13 Nigerian women dies in childbirth, and we're working in 6 states, the data begins to tell its own story. So the data is driven by people now. So from the data end, I would say to you that the World Health Organization's recommendation is that women in low and middle income countries should have 8 visits throughout their antenatal and postnatal period. Where the person is at the Liverpool frontline, my midwife is the interlocutor who's delivering the lessons, and the women are eager. They're coming. We've also set up WhatsApp groups for each class. I personally, because I can't be at the front line every day, but I'm on every WhatsApp group actually, and I'm reading the conversations, and reading the mothers' conversations is helping me to shape the program. So for instance, as the COVID lockdown started, all the mothers were questioning, can I still go for my antenatal? Can I still take my child for immunization? So I very rapidly reached out to the Primary Health Care Development Agency and said, please, please, will you keep at least one PHC in each local government area open? Because I know you're doing isolation and all this, but childbirth doesn't wait for anyone. And when you're having a baby, it can be a very vulnerable time. So you need the support of your care team, as well as hopefully your birth partner. Now, of course, in many countries, as in Nigeria, your birth partner, until COVID is over, is not allowed into the labor room. But that makes your midwife all the more important. And that makes it all the more important that you've gone for your antenatal, whether physically or virtually, so that you're familiar with your midwife when you present. For me, I put it very simply. My M&E team would give you sheaves and sheaves of data. But for me, it's a once a month investment throughout that pregnancy. And then the mothers stay with us for life. They become peer educators. They teach other mothers. And it's wonderful when you see a mother come back in her second pregnancy. And we have mothers who are all over the place in Nigeria. It makes no difference, the postnatal visit. It doesn't matter whether you're in a hut or whether you're in a palace. Your mama care midwife will reach you, and you can call her, you can WhatsApp her, and you will get an answer. Of course, as the classes grew and grew and grew, we now developed a chatbot as well that can, download some of the textbooks, download some of the educational material. And then, of course, there's social media. The power of social media is incredible. So through the Maternal Monday campaign, we're also delivering lessons on social media. There's a topic of the week, and the mums can come in their own free time, look at the pictures, see other mothers like themselves, make their comments. And for me, it's just if we can save the lives at birth with the right technical skills, the right manner, the right companionship, the right counseling, we're setting that woman in a stronger path to be able to nurture her family. And if her family rises, Nigeria rises too. I feel that Africa has always had a very strong matriarchy. That matriarchy has been eaten into from the women's leadership perspective by the economic realities. But it's time to reinforce and replenish the good parts of our history and our tradition to ensure that our young women I won't say of tomorrow, our young women of today rise to the women leaders we had of yore and take us forward as a nation. We will not be able, even as a continent, to move forwards if we leave half of our population behind, which is the female gender.
A lot to digest there. Again, the importance of having these conversations so that others can kind of take on from your strategies and your lessons learned. I think what you sort of explained speaks to what you spoke about earlier about sort of bringing these skills and the training down and meeting these women sort of at the level and capacity that they have to sort of better understand their maternal sort of health status. And I guess it improves maternal health seeking behaviors and the overall female health status. So thank you so much for taking us through that. You've sort of jumped the gun on my final question, but I wanted to sort of pick your brain on this as well. The World Economic Forum states that the quality of life, specifically in relation to health for females, is severely diminished in comparison to their male counterparts on the African continent. So obviously, for example, maternal mortality rates and the sexual and reproductive health complications still being quite major risks. And research suggests that the sort of gender dynamics in resource allocation and women's limited representation in decision-making positions have this domino effect, which affects maternal health seeking behavior and the overall female health status. So it'd be great to get your thoughts on the matter, but also in your experience as the Global Goodwill Ambassador of the International Confederation of Midwives and the very many leadership positions that you have. How have you, in your own opinion, personally been able to affect change in this regard? And what are some of the solutions that the government, CSOs and private sectors should look at implementing to resolve this issue?
What I would say is that if we really want to ensure that we can actually build a pipeline of confident, educated, empowered girls into confident, educated, informed, knowledge women who are active, we have to actually start from the practical basis. We look at the social determinants. We look at what is the investment into every African in the first place. Then what is the investment into girls? And I will tell you that there is a little statistic that is often overlooked when you're comparing the health of boys and men to the health of women and girls. And that is the correlation between nutrition, menstruation, and anemia. Men don't menstruate. So their need for iron is there, but they don't need to replenish their iron and folic acid on a monthly basis the way that a menstruating young a girl or an adolescent or a woman would be. So you begin to look at health from the wider perspective. If you're looking at the state of women, you have to look at nutrition. You have to look at whether there's been any childhood stunting, which affects brain development, and what you can do to actually combat that. At the Wellbeing Foundation, we have a fortified partnership, which is looking into an innovative blend of an iron fortified proprietary ingredient that can go into the tomato paste that we all eat every day. We all use it to cook stew. And if that could just go to scale, I believe we would be able to drop iron deficiency, anemia, and then equally drop the rates of early childhood development challenges, that malnutrition, the malnutrition linked ones, exponentially. We have to make daily investments into our girls and also actually into our boys, and in their knowledge, their understanding of each other, the respectful relationships, in order to have this environment where you don't have to claw upwards to rise. The rise should be how much has been invested in you, how hard you are prepared to work, and whether your social protections are in place. I'm sure you saw just a few days ago the death of a young Nigerian woman who she was job seeking, like so many young women are job seeking around the world. So we even have to go back and look at our laws. Our law states that the police will not assist in looking for a missing person until the person has been missing for 2 days. In that 2 days, she was allegedly raped, beaten, and killed. Now, if we had a sexual, gender-based violence law that would have kicked in immediately, I have been calling for a register of missing persons since we had our internally displaced and refugee situation in 2014 with the disappearance of the Chibok girls. Now, had we responded to that emergency with a nationwide register of missing persons, then perhaps this young lady might have been found and saved. But then you can't denigrate the power of social media, because if you actually look, I believe Nigerian population is one of the highest users of Twitter around the world, and now the missing persons alarms, they just go out on Twitter and everybody's doing their bit. So you see, not just Nigeria, across Africa, you see citizenry that are engaged. You see a citizenry that actually has social responsibility. You see a citizenry that is eager to swallow and to grow and to digest whatever is, I won't even say given to them, whatever is within their reach. So I think it behoves on all the sectors to work together to make sure that more and of the right quality is within reach. We also have several Nigerian women doing us proud around the world, but I have always taken a global approach to it. It's not just about being globally recognized, it's about actually being your sister's keeper and taking it upon yourself to take an interest in the issues and to begin to demand or insist or request, according to your personality, what you want the present day and the future of our country and our prospects to be. I don't believe all is lost, and I believe that Nigeria can and will reclaim its position as the giant of Africa, but it's going to take very deliberate and very intentional investments and action.
Yeah, I completely agree with that. Thank you very much for again sharing that with us. And I guess it appears that the Wellbeing Foundation, I mean, on the back of your very many sort of global advocate positions, you know, takes great importance in being able to implement a lot of strategies locally and remain at the local level. And as you mentioned, remaining, the sisters keeper being that being the focus. And again, sort of speaking to very many Nigerian women doing amazing things across the globe. But hoping that we can actually replicate that on the ground in Nigeria. And quite final points. This is a unique conference because it's the first of its kind. It's a virtual conference, and it's happened during a very difficult time. But we try to look at the positive side of things, and one being that this conversation will be a point of reference for future years to come. And so on the back of that, are there any things that you want to share with the youth that may be watching this at this present time?
Well, first of all, I want to thank the youth experts of the Wellbeing for Africa's Youth Initiative, who worked so hard with us. We had 66 youth experts in, I think it was 34 countries, and they produced over 300 bodies of published research work at areas of expertise that they chose themselves. The initiative was actually crafted to build expertise in international development for young people, but not from a benefactor perspective. We just wanted to make it possible to mentor young people and then for them to choose their own areas of expertise, write, research, undertake community projects, and share their findings with us, which has really helped us to actually shape our program. So they launched the Wellbeing report in 2020, which actually showed us that we required a greater intentionality in actually allowing youths, if we are in control of the table, making a seat at that table for the youth. But as the young experts were working, their way through the 4 years mentorship, I realized that actually they were no longer asking for a seat at our table. They had made their own table. They had done their own findings and they were moving on with their lives. I've seen so many of them rise to leadership positions in their fields in different countries. And I've seen young people who used to come and do summer camp with me now becoming climate experts around the world or SGBV experts. So, what I would say to the young ones is that please share your opinions and your knowledge with us in the different generation, because I'm actually at that age now. I mean, I'm sure you know I'm grandma age now, which is an age where women are normally probably expected to retire. I'm not retiring, I'm not going anywhere. You know, the people often call me the mother or the guardian or the angel or the grandmother of maternal health. And it's not because I do the same thing the same way all the time. It's because I'm constantly studying every age group. I'm constantly studying the front line and I'm constantly searching for better ways to do it while reinforcing the things that I know work. What we really need to hear now is not the youth opinion, but what the youth intend to do and how we can meet with you and partner and how you can teach us actually better ways and new ways of looking at things. And I think that this intergenerational exchange of knowledge will lead naturally and painlessly to the shift in leadership. And then we're ready to pass over the baton and hand it over to you. I really, really look forward to seeing a lot of the experts that I've seen grow, including yourself, Chi. Take your place in the world and lead.
Thank you very much. So to me, that sounds like you co-sign intergenerational leadership, which is a big component of rewriting the African story. Brilliant. For me, this has been an absolutely insightful, fantastic conversation. I look forward to this being, again, as I mentioned, a future reference point for not only just the youth of Africa, but everyone working within your industry. It is important for us to share stories of excellence within every industry so that we can also kind of pick on these strategies and implement them in other parts of the continent. So from me and all the others that will be tuning in and watching you, thank you so much for joining us and giving us your time.
Thank you very much, Chi, and thank you to the Oxford Africa Society. It's been great to talk to you, and I hope to stay in touch. And if any of you is ever swinging by Nigeria or Ghana or any of the places where we work, give us a call.
Good luck. I think a lot of people will take you up on that offer.